Good evening, and thank you for joining us here this evening. I'm Dr. Edo Fardy from Seapoint Clinic, and I have with me Dr. Alessandra Barbedo. She qualified in Brazil, and in Portugal, she did a specialty degree in orthodontics. So I'll pass you over to Alessandra, who's one of our lovely team members, and she's going to give the presentation this evening.
So good evening, everyone, and thank you, Ed, for the invitation to present a bit of orthodontics in our Seapoint Clinic webinar. I'm delighted to have you here today. And talking a bit about myself, I am originally from Brazil. I did my graduation and specialization there, and then I did my master's in Portugal. Orthodontics is a field that I'm truly passionate about. And since I finished my specialization, I've been continuing studying about the field, because I believe that if we have the best technologies and the best techniques, we can offer a good treatment, which is smooth and comfortable for the patients.
Excellent. I see you use the scanner a lot, and you get some great before and after simulations for people before they even start the process. Isn't that the case?
Yeah, I think that the best technique or advancement that we have in orthodontics today is to be able to show patients how the treatment or how the result will look like in the end. Also, something that I believe that is very important is I can, with this scanner, I can show the patients everything that I see in their case and how I would change, because sometimes it's hard for the patients to understand when we are talking about bite or teeth position, and the scanner gives us like the best view for the patients to understand it.
Well, I was very impressed as sitting in the chair with you and seeing my own teeth on the screen and side-by-side images was really, really impressive. It's technology has come on so much, and you're right at the cutting edge, which is very impressive.
Yeah, like I think that is, as you said, it's impressive this, and we can also match pictures with the scanner, so the patients are not going to see only the result on their teeth, but they can see in the face. So this is very good. And also, if they want to go for composite bonding, which nowadays they really want to do after ortho, they can also see a simulation after the orthodontics with the composite bonding, how it will look like in the end.
Amazing. So for those who don't know, composite bonding is used to reshape the teeth sometimes. So for adults particularly who've got maybe tooth wear or little chips or the teeth, so the teeth could be moved into position with orthodontics but aren't going to be perfect at the end. And by adding a little bit of composite, you get a lovely finishing touch. It looks just amazing at the end of treatment.
Yeah. Perfect. So I will start the presentation, Ed, and you feel free if you have any question or if someone have any questions, okay?
Thank you.
So again, welcome everybody for our webinar from orthodontics. Today we will talk about pre-orthodontics, but also a bit of orthodontics too. So the parents and the kids will be more than welcome to our clinic. I really love what I do, again. And I like this human part where I explain every step of the process so the patient or parents and children can be informed and confident with their care. So at Seapoint Clinic, we have world-class care in state-of-the-art facilities. As Ed mentioned, we have all the top edge of the scanners, materials, techniques. Our team is always learning and trying to offer the patients the best techniques that we have, and also offer the best treatment plans, and not just regarding about techniques, but costs as well.
Right.
So we have a poll here that what would be the biggest concern about the orthodontic treatment? These are the most common questions that we receive usually in the first consultation. Are you putting the poll now, Ed?
Yeah, I'm going to put the poll up for everybody who wants to give their 2 cents. I'm sure there's lots of different views out there. Perfect. So they can work on that and we'll get the results a little bit later on.
Perfect. Amazing. So this is the most common question that I've been receiving from parents, which is when should my child visit an orthodontist? So the American Association of Orthodontists recommends the first visit at age 7. At this assessment, we will check growth and development. Even if the treatment, if it's not needed yet, what I usually explain to parents that not treating now is already a treatment, but we need to assess. We need to see if the patient has all the permanent teeth. We will take an X-ray so we can see if the permanent teeth are all there. If we have the upper and the lower jaw growing as it should. One of the signs that I believe the child may need braces, and I ask parents to have a look as well, is we need to look for crowded teeth or overbite. Overbite is when our upper teeth covers a lot or completely the lower, or underbite when they don't cover at all. Or if they have a difficulty in chewing, this might indicate the need for braces or aligners.
Okay. Last question just on that. So I've got 2 daughters, 8 and 10 years old. I was surprised that you need to be checked so early, because it used to be, 12 years old, or was, when the adult teeth were through. I think a lot of people would be surprised that it is so young, but I've seen myself the benefits of getting them checked earlier, to have that interception done if necessary, to have, the certain teeth taken out to make an easier pathway. So I think it's a really important point you've made, that it is good to get checked at a younger age than previously would have been the case.
Yeah, like what I usually explain is that this will prevent future complications and even more expensive or more complex treatment afterwards. So, for example, if the patient has a crowded teeth, this means that we don't have space for the teeth in the arch. So we need to make room for the permanent teeth. Worst case scenario is that these permanent teeth, if it doesn't have place to come out, it can stay inside the bone, which in the future will lead to surgery and complex cases, or even extraction. So if we see it when the patient is growing and have this eruption process happening, it's way easier. We can prevent doing some baby teeth extraction or opening give more space in the arch. And then we prevent this complex treatment in the future.
Excellent. So taking advantage of their growth is obviously a really important thing that this helps with.
Yeah. And another myth that usually some patients or some parents believe is that, my child already have a problem. And I believe that once my child grows, this will be like corrected, or I don't need to do anything. But what I like to explain is that if we already have a pattern of growth, let's say the upper jaw is growing more than the lower, or like the lower more than the upper, this will just accentuate in the future. So this is not going to self-correct. This can even get worse. So this is very important for parents to understand that the growth will just, if we have a pattern, we need to change a bit, because it can get worse in the future. Excellent.
Okay, makes a lot of sense. And for people who have prominent teeth, they can end up getting trauma, can't they? They can end up getting the teeth knocked out if they're particularly bad, or getting a broken front tooth where a tooth is too prominent, whereas that can be treated with braces and stop the damage.
Yeah, one of the cases that I usually recommend treatment is when we have a position sometimes of the front teeth that can lead to trauma, as you said. So this is something that we can, especially if the kid plays sports. So this is a case that orthodontic or pre-orthodontic treatment is advised.
Excellent.
So nowadays we have Invisalign, which is the clear aligners treatment, and we also have braces. So after the parents have the diagnosis, and if we need to treat, then we go for the most common decision, which is braces or aligners. So I like to explain that braces, they are fixed, and they are ideal for complex cases. But we need to bear in mind that we have some dietary restrictions. So we should avoid some hard food, nuts, popcorn, and these kind of things. And the most important thing, it requires a good oral hygiene, so we don't have decays around the brackets. But they are very comfortable nowadays. Patients, they feel like even if they can go for ceramic, for example, so it doesn't appear that much. The second option is the aligners. The aligners are removable and less visible. They are more for mild, moderate cases, but sometimes in some cases we can start with fixed and then go for Invisalign if they want. There is no food restrictions, but on the other hand, the patient needs to wear 20 to 22 hours per day. Which, to be fair, like after I present these to the kids and the parents, the majority of the cases they already know. Like I have the kid look into the mom or dad and say like, okay, I know that I'm not going to wear them, or like, oh no, I'm very responsible. I feel that I can go for it. So, but I like to explain and tell them that we have options for their lifestyle at the moment. So both of them are good and accommodate sports and activities. So there is no restrictions for like, oh, if you go for aligners, you can't play sports. No. And exposing these parents with the kids, they decide together which fits best to the lifestyle that they have.
Excellent. I mean, I myself, I had the Invisalign in the upper teeth. I had the aligners, the brace in the lower teeth. I found it super easy. Worked really, really well. It's they're so invisible now. Those brackets are barely visible in the photo. So the technology's come on a lot in the last few years.
Yeah, and I believe that I have usually teenagers. They don't want like to show a lot the braces. But if it's a complex case, sometimes we need to mix. So it's very good, like to have like braces sometimes, or to start or in the lower arch and then go for aligners on top. So we can mix. It's amazing what we can do even with working with both options.
That's great.
So how orthodontics can affect health and confidence. I like to say that it's not just straightened teeth. I think that sometimes in some treatments, orthodontics will improve speech, breathing, and digestion. So we have some treatments that were actually referred by the ENT doctor because they need to sometimes open the airway to make like kids that are snoring or they have like a mouth breather. This is a very good example of health benefit.
And doesn't mouth breathing affect the whole face? I mean, isn't it? You see things on Instagram that it's really important not to be a mouth breather. So obviously this can help with that at the right stage. This can help develop the face correctly.
Yeah. So we use if we treat this pre-orthodontic part is good because we use the growth in our favor. So if we give the information while the patient is growing, they will finish the growth with the new information and how it should be. So we don't have only a teeth result, but we have bone result. So we give more quality of life to the patient, and also the risk of relapse, meaning the teeth going back to the old position, is a bit less if you compare to an adult, because you have bone results as well. So I think that it's very important to treat at this age.
Great, makes sense.
The other thing is boosting confidence. Nowadays, we live in a society that sometimes bullying is something quite normal. I have patients that come to me like parents concerned that kids don't like their teeth. So once we treat this, we boost their confidence. They can smile. They improve their self-esteem and social confidence as well.
Amazing. I think it's amazing when you see a smile change at any age, whether it's a child or an adult. People do change their whole confidence. They smile more, they respond more to the world. So it's such a great boost for a child or an adult, and orthodontics is amazing for that.
That's I think that this is one of the biggest things, or the most important thing that I like and I love in my job, because it's not just like going for the functional part or technical part. For me, the best compliment ever is when the patient just tells me like, oh, I didn't smile to the pictures. And since we started the treatment, because you can see a very good result during the treatment. So they are able to smile, and they come to the consultation just saying like, oh, I'm so happy. I am, and now I smile to the pictures. This is the best compliment ever, like, because this is quality of life. It's just self-esteem. So it's not just about changing like function or something like that.
Absolutely. It's amazing.
Yeah. So the other thing is, as I said, preventing long-term issues. So once we we treat the kid, we prevent future dental problems like tooth wear, jaw pain, gum recession, and also you will improve oral hygiene, because in cases that the teeth are overcrowded, as soon as we align them, kids or patients in general will be able to clean them, reducing the risk of cavities or gum diseases.
I think it's a big one for health as well. I mean, there's more and more links between oral hygiene and systemic diseases. Even this week there was a thing about dementia. So aligning teeth can massively help to make things healthier in the mouth. And the mouth is a window to the body, so it absolutely makes sense. If you can straighten the teeth and make them easier to clean for life, you're less likely to lose them and have fewer health issues. So that's a really, really good point.
Yeah, no, I think that this is like, this is another thing that a lot of patients refer that before starting the orthodontic treatment, they had problem flossing, especially on the lower teeth, the anterior teeth. And after they aligned the teeth, they were able to brush it better, to clean it better. So, and this is quality of life as well, as you said. So it can prevent loads of problems too.
That's great.
Perfect. So some tips that I like to give to patients is good, not just for the patients that are in treatment, but for the ones that are planning to start, because it's something that they can expect what they will have to do when treating with aligners or braces. So what I usually recommend for oral hygiene is like brushing and using a soft bristle brush. Fluoride toothpaste is very important to prevent any risk of cavities, twice daily. Flossing, floss threaders, or for kids, water floss works very nice, because sometimes it's very hard to floss like with the wire and the brackets. So water floss is something that helps us a lot to keep the braces clean.
It's like a water jet or something similar to that, is it?
Yes, something like that. Yeah. Great. And the aligners, the care that you have to take is that you have to clean them twice per day. And you can use mild soap, soft toothbrush, and in some cases even toothpaste if you're like, you want to have a cleaning before put them in. Foods that they need to avoid. So sticky foods, such as gum, caramels, chewing gums, caramels, hard nuts, hard candies. And also another thing that I usually advise is that they need to avoid eating or using the front teeth to split the food. So let's say they are eating a pizza crust or chicken wings or something like that, or apple. Instead of using the teeth to split the food, they should cut and chew with the back ones.
Okay, that's a good point.
And safe snacks, or what I usually advise is like soft fruits, yogurt, cheese, pasta, mashed potato, like nut butters, the smooth nut butters, but avoid everything that is too crunchy, because if they break the bracket, that tooth won't move, and this can delay the treatment.
Okay.
Then common issues that we sometimes have is broken brackets or wires poking on the cheek. So we have a very good thing that I advise, which is orthodontic wax, that will protect and prevent the wire poking on the cheek or the bracket sometimes gets loose and is a bit of uncomfortable. And of course, contacting us as soon as possible so we can sort that out. The good thing in C-Point is that we have not just me, but we have our orthodontic therapist. So the patients have a lot of options of time available. So sometimes they need to go like after school hours, like some days I am there, but if I'm not, the orthodontic therapist is there as well. So, and we also work 2 Saturdays a month. So it's like we have more time available to fix this or even for consultations.
That's great. So if you're in the weekend, you can get some help.
Yeah.
Yeah.
The other thing that can happen when you're treating with Invisalign is that if you lose your aligners, I always ask patients to always keep the last aligners with them. So if this happens, they go backward. And of course, contact us and we will order a replacement for them. And if any, nowadays, the brackets or Invisalign, they are very comfortable. We work with very good materials that offer that makes the orthodontic journey like smooth and comfortable. But just in case, we usually advise over-the-counter pain relief, opt for soft foods in the first few days, and orthodontic walks if needed.
I remember when I had my braces on, I went for a soup. Yeah, it was a tomcat guy soup, and I couldn't bite for the first day. But after that, it was super easy. But I was worried day one that I would have issues. So it was reassuring afterwards. It was, once day one was gone, I was absolutely fine.
Yeah, like usually I say that the first 2 days max, it will be like a bit uncomfortable, or they can feel a bit of sensitivity to bite hard food. But after that is like normal life. And to be fair, kids nowadays, they arrive in the second appointment saying like, oh, I didn't feel anything. Because as I said, the materials as well help us to provide like more comfortable treatment.
That's great. Mine was 15 years ago, so it's come on a lot since then.
So this is, I believe that is one of the most important parts, is that what happens if your child doesn't get the treatment. As I said before, we are working and we are using the growth in our favor. So if we delay the treatment, we can in the future get more invasive treatments or increase the dental problems, and also more expensive treatments as well. For example, sometimes we have these, as I referred before, upper and lower jaw, like the lower coming a lot to the front while the upper stays backward. If we see this while it's a kid, while the patient is growing, we can prevent, for example, from a jaw surgery in the future. The risk will be always there because we need to wait the patient to grow. But like, if we don't do anything, 100% the patient will go for jaw surgery. Or if a permanent tooth gets inside the bone, then we will have to assess the tooth with surgery and then pull the tooth. So it's more uncomfortable, it's more expensive, and it's more complex. The other thing that is very important is that we are talking not just about aligning teeth, but we are talking about the bite. So I usually compare the bite with a car. If something goes wrong in your car, it's not going, you can't drive. So if we don't correct the bite as well, that sometimes the teeth they are aligned, but the way that upper and jaw sits together, they are not 100% good. And then we can lead to jaw pain and our joint issues, tooth wear, damage, like breaking. Sometimes if we have a heavy contact, meaning that upper and lower biting too strong in one specific tooth, we can break the tooth, we can have tooth wear. So this is very important to treat at this age.
Okay.
The other thing that I like to monitor is the eruption, to see sometimes there are cases that baby teeth stays for a long time or more than it should. So that's why we have this amazing X-ray that we can see baby teeth and permanent teeth. because we check, and if it's time for the permanent teeth to come out and the baby teeth, it's not like wobbling loose, we will have to remove it. And this is like very important to prevent a complex treatment in the future.
Makes sense.
About the cost and payment options, I think that is very like a positive point from C-Point, and all the patients love is that we have these payment installments. So usually patients will pay a deposit. This deposit is also facilitated because we split this in 2 consults. So deposit an average is like 1,500, but they will pay 750 in the first consult and 750 on the second consult once they decide to go ahead. And the rest of the treatment usually is split during the treatment time with around €300 per month.
Okay, so it's very handy. They can literally do it on direct debit instead of having to get a lump sum and every so often.
Yeah, they don't have to worry about like paying every consult. They have direct debit.
Okay.
The treatment usually is around 12 to 24 months, depending on the complexity. But the patients will be able to split this by direct debit. And also some insurances, depending on the policy, they will cover part of the orthodontic treatment. And the best part is that they can avail 20% on tax reliefs with the orthodontic treatment. We provide the MAT2 form, so they can get this 20% back when they do their taxes.
That's great.
Yeah. Well, we, as I said, we have these flexible payments. We need the deposit, but after that is €300 per month. If some patients want, we have this third-party financing. It's easy to approve. They have flexible terms, so it's another option as well. So we have plenty of options of payment. So everybody lives very happy with the treatment.
And so to be clear, there's no, if somebody comes along for a consultation, they don't pay a deposit then. It's only if they want to go ahead, if they decide to go ahead, then they pay the deposit to get the braces ordered and designed, etc. And then they go on the direct debit afterwards.
Yeah, so the first consultation is the consultation that we will take the x-ray, we will do the scan, pictures, I will cover everything with the patient, what things that I would change, how I would treat, I will give treatment options. So this is the first consultation. The patient leaves with the treatment plan and the price. Then if some patients decide to go ahead right after, so they pay the deposit, or the good part of having all these done, exams, x-ray and scan, is that they think they can just, the girls can take the payment over the phone, so they don't have to go back to the clinic. We send to Invisalign, or we'll prepare to get the braces placed, and happy days, they don't have to return to the clinic.
Yeah, that's great.
Yeah. So top parent questions is like, will my child need teeth extracted for braces? What I usually explain is that sometimes no. The biggest thing here is that to prevent any permanent teeth impacted in the bone. So if needed, then we will remove baby teeth. But nowadays, as the patient is growing, like permanent teeth, we usually don't remove, only in very complex cases. But baby teeth, occasionally we need to remove to prevent any complex treatment in the future.
Can I ask, Alessandra, so the kind of traditional braces in Ireland years ago would have been extracting a lot of premolars and closing up all the gaps, whereas the American smiles were much broader. They were, they wouldn't have extracted the teeth as much. Is that correct?
Yeah. So in the past, premolars extraction was a very famous and most common treatment. Yeah. Nowadays, with development of orthodontics, we can use a lot of devices and treatments to open space to bring the permanent teeth or to align the permanent teeth, and also to prevent these premolars extraction.
So it's a broader smile and a nicer smile, really, at the end of the day.
Yeah, I think that nowadays the technique is more bringing more the smile wider, making it
Julia
wider.
Roberts style.
Yeah.
Great, sounds good.
And if it's the case, nowadays we prefer to remove wisdom teeth.
Okay.
Rather than like the patient staying like with the space here and closing. So it's another option. So we just go for premolars extraction nowadays if there is like no other option.
Very severe. Okay, perfect.
Yeah. The other question is, how do I know if my child actually needs orthodontic treatment? So now I invite you to come to a consultation for the first assessment. As I covered before, if your child is 7 years old or more, you should bring the kid for the first consultation. Then we will assess. We will make all the exams, X-ray scans, and then I will build the treatment plan. Some patients, we don't need to do any intervention at the moment. And if it's the case, I usually ask the patients, the parents, to bring them every 6 months or every year. So we take an X-ray and we keep an eye, because sometimes as they are growing, things can change. So if you really want, keep an eye on the items that I said, how like things that can caught your attention. But also the most important is bring your kid to a first consultation with the orthodontist.
Okay. Can I ask a question? I'm just wondering, what percentage of kids would you say don't need braces these days? I mean, it seems that a smile is so important. It's, what was a decent smile before is now considered suboptimal. I don't know anybody who doesn't get braces personally anymore. It's whereas years ago was kind of only for the worst cases, whereas now people want to have a perfect smile, for work, for life, for relationships. Do you have a percentage that across the board, or is it, just not that easy?
To be fair, I think that in the end, 90% of the patients will need braces or will need orthodontic intervention. Yeah. It's just about the time. Yeah. So there is a range, let's say from 7 to 10 years old, or at 9, 10 years old, that we will focus more in bone and make sure that we have room for the permanent teeth. Yeah. And if like we have any bone issue, any bone problem, like upper and jaw, like are not sitting good and nice, then we will be targeting this. Okay. After that, once they have like permanent teeth, then we focus on the orthodontic treatment, aligning teeth, and that's like this part, usually 90 to 95% will go for it. Yeah. But sometimes if the patients, they have a good bone relation, they have space for like all the permanent teeth, we just do a follow-up to see if it's not going to change the scenario during the time. Yeah. But orthodontics nowadays is something that is almost yeah. So how can I monitor my child's progress during treatment? The first thing that I like to show parents is like the scan that we do on the first consultation and the pictures. So they have like day one comparison. The second thing is like I like to take the OPG's new pictures. I like to send to parents so they can understand, look, the tooth in this x-ray, the teeth were like this, now they are in this position. You did
it for us. You did it for my daughter recently, which was great to see the movement of the tooth, yeah. So it's nice as the parent to see that as well.
Yeah, so that's why like I like this scan. I like the x-ray, even if it's more technical. I like to show the parents, and after I explain, it makes a lot of sense to them. See, now we have room, this tooth is coming down. I think these are the most, and even pictures. I have parents that they say, I took a picture of my kid, and now I can see the difference even in pictures that we take.
Amazing.
Yeah. What happens if my child doesn't follow the treatment? So this is very important, not just following the treatment, but following the hygiene instructions and the dietary instructions as well. So the biggest thing is that the treatment will be delayed, and sometimes it delays like a lot. So we try to every consultation, if the child is not following the treatment, I like to understand why the child is not following the treatment, what is going on, so we can make like the lifestyle to fit in the treatment. Because it's very important that the child likes the treatment, understands why we are treating. So the biggest thing here is that it will delay the treatment. So they need to be very careful on braces. Don't eat, as I said, hard food, avoiding like breaking the brackets or not wearing the aligners. And worst case scenario, sometimes there are patients that at that moment they are not ready for the treatment. This is something that we need to consider when we are building a treatment plan, and then we go for a second treatment in the future.
Okay.
And the last one is, does orthodontic treatment affect my child's sport or musical instruments? Thank God the answer is no. So even if they go for braces or for aligners, they will fit into the child's sports or musical instruments. But of course, if they play some specific sports, we recommend mouth guards to protect. Some musical instruments in the beginning, they could be a bit different, but it's the same as when we put the braces. It's just 1 or 2 days, and then it will be normal life.
Okay, that's great. So you've got a future up-and-coming rugby star. You can still play rugby and with the right.
Yes. Yeah, hopefully I am treating a lot of future rugby stars in C-Point.
Sounds good.
So, to sum up what we discussed here today is that I advise 7 years old to start the first assessment, and early treatment is important to prevent any bigger problem. Braces and aligners, both of them will be suitable, usually are suitable for the cases. Sometimes we need to mix, start with fixed and then go for Invisalign. And treatment time in average takes between 12 to 24 months. The benefits here, this is not just about kids, but treating like all the patients. We will be improving speech, breathing, confidence, and prevent future dental issues.
Just on the timings there, Alessandra, that people will see changes generally within a few months, won't they? That, there's improvements quite quickly with these. It's not like, you wait 24 months to see a change. It's like within a few months, you can really see you're getting somewhere.
Yeah. So usually like the first few months, they will start seeing already the results, especially if you have overcrowded teeth. As I mentioned before, some patients during the treatment, they say, I wasn't smiled before, and now I am. Even during the treatment, they start smiling because they can notice the treatment. So I like to say that we start with an aesthetic result. Mm-hmm. So they will be seeing, like in the first few months, a very good result.
Excellent.
About cost and payment, so we have a very flexible plans. We have the 20% tax relief, which we give the mature form for revenue taxes. I think that is very important. Is like nowadays to be like to fit in people's pockets the treatment, so we can make it work, and we can build the dream smile that they have. I think that the cost and payment options that we have nowadays we planned to offer a very good and affordable treatment, so they can go ahead and start building this dreamy smile.
That's great. And there are also discounts for a second child in the family, isn't it? If there's more than one child, there's discounts available.
Yes, we do have family plans. So we usually parents and kids, if they're treating with us, they also have like a good discount, which we call family discount, if they start the treatment with us.
Excellent. And then for anybody who's joined us this evening, there is a free consultation available with Dr. Alessandra, which is very kind of her to offer. So for having come along this evening, you get a free consultation. So just email us on info@cpointclinic.ie, and happy to set that up for you.
Yeah. Please, we'll be more than happy to have you with me and to do the first assessment in your kids as well.
Most common issue people came across was the length of treatment was their main concern. So I think you've addressed that it's usually 12 to 24 months, but you will see changes sooner than that. So don't worry. It's it's not waiting 2 years to see anything. You will see things pretty quick.
Yeah. So as you said, like you will be seeing results in kids. Actually, like you see, like in the first month, you can already see a very good result because they are growing. So it's amazing. But yeah, don't worry. Like this will take time to give you. Like this is the amount of time to have everything, all the problems sorted. But you will be seeing results in the first few months.
Excellent. Okay, so for anybody who's got any questions, again, you can email us info@cpointclinic.ie and we will get back to you. We really appreciate your time this evening, and thank you, Dr. Alessandra, for your time. It's been an absolute pleasure speaking with you, and look forward to speaking to you soon.
Amazing. Thank you, Ed. Thank you, everyone, for joining us, and I'll be waiting for you.
Take care. Good night.